Thank you very much, Dr. Eric, and also Dr. Joe, and also the panel. I'm quite grateful to have the opportunity to talk with us. I want to talk more about, just to follow the fall, we are going to talk more about the public health strategies. So I put that picture, I see there have been tremendous efforts have been done in China with colleagues in the front line, with colleagues in the public health, and also in colleagues reaching out to communities. What we can learn from this experience and what can be reflected to Canada and also the international community, I think that is a very important question to all of us here in Canada, but also to the international community. So I took that picture because I used to work in that district in Shanghai. So now, should we talk as a pandemic? So the recent WHO definition is not still a pandemic yet, but we have seen very rapid progress of the disease. We have seen almost like 80,000 cases, almost like 2,700 deaths of the disease. And especially in the last 24 hours, we have seen the disease outbreak in Korea, in Japan, and also in Italy. So right now, there's almost 11 cities locked down in northern Italy, close to Milan. So that shows us that transmission is highly likely. And even the WHO has put it as a high risk for global transmission. So in a word, we have to be prepared for this. So second thing, what we can learn from China right now. I just want to follow with Dr.
Bogosh. Yeah, terrible name.
Regarding, regarding about, we have different categories of the symptoms. We have mild, lots of people with mild the symptom, and a small proportion of people have kind of moderate symptom. Less than 20% had a severe symptom. So how would we set up an effective sentinel and early warning system in the hospitals to tell us, okay, we need to be prepared for that? For example, in Ontario, how we should get a plan to set up the fever clinics. And that plan should be triggered by the number of the patients can be detected from the hospital settings. So we should get prepared for that. And second thing is about sector-wide resources allocation. That's not only about the sector for health, also for economic sectors, and for the public education. So when should we channel information about, for example, we talk about should we wear mask right now in Canada? So the risk of transmission is still quite low, but depending on how many patients are going to be detected in the hospital, we should trigger a number of different actions. And also, we have to learn about the effectiveness of the city lockdown in China. So if you look at all the cases up until now, about 85% or more than 85% of cases in the world now are contained in China. So if you look at China, it's over 90% of cases are in Hubei province. And if you look at Hubei, it's about 80 to 90% are within Wuhan, the city. So that gave us a kind of rough idea that the effectiveness of the city lockdown has really been made quite apparent to us. I think in another way, China has sacrificed by locking down its own citizens by the epidemic center. So that has tremendously helped the world to gain the time to get prepared to the virus. I think all of us, including every Canadian, should be thankful for that tremendous effort has been done in China. And the third thing, the fourth thing, I think, is about infection control measures for the frontline health workers. because we have seen about 2,000 health care workers in China have been infected. About over 20 have died from the coronavirus outbreak. And even though we do not have more data on that, but what we can learn is that more people more health workers were infected because they are in a different department. So most people were not from the respiratory department. Because for ID physicians, respiratory physicians, they get used to this kind of high alert, get well protected. But for other departments, they might be alerted to the scale of protection. So that is something we need to learn more closely, how these measures have been triggered and who have used these measures and how effective the measures are. So the last point I want to say is about coordination. It's really a team effort. Even within the sub-health sector, we need to look at about the medical part. From hospitals, we look at the public health agencies, and they have to look at how to coordinate with primary care providers. Because that is a flu season, people will be worried about being infected with the coronavirus, but at the same time, lots of people will have just a seasonal flu. So there are a couple of things I will not definitely go over this. What we can learn from China for Canada, maybe first they need a multi-sector preparedness plan. So I have seen lots of efforts have been geared toward this end, but there is not clear. For example, if outbreak, community-based outbreak happening in Canada, where should people go to treatment, and how people can be connected with public health agencies while doing the home isolation, etc. I think now that we can learn a lot about clinical diagnosis, treatment guidelines, etc. So I think that specifically two things we have to be aware. One is that how can the confirmation of cases be diagnosed? So in China, there's many different kinds of testing toolkits for the novel coronavirus, and there were different informations in that toolkits can only detect up to 50 to 70% of the cases. So how accurate they are. And second thing that should we apply for the clinical diagnosis using for example, radiology, CT scan, etc. So because you can say in China it has been a change of the definitions that has been related with the change of the reported cases. And specifically, we have to learn what is the role for family physician teams here. So not only provide the treatment, but also how to handle differentiate people who might have a travel history to Wuhan or the epicenter in China, and with people who just have mild cases might be more likely to be a seasonal flu. And the last point is that what would be the message, the support, psychological support, economic support we can provide to patients who volunteer themselves to be isolated at home. And there is also lots of message we can learn from China to other developing countries, because in most of the developing countries their resources are very limited. For example, in Iran, now we see the outbreak, and it might be the outbreak in Cambodia, in the Philippines, etc. So there's a big public and private sector mix in these countries. So what are the roles for the different players? For example, for the public sector, it might be the role of the treatment center, and also probably the place to detect the first few cases, but it would not have the resource to manage all the cases, and how to involve the private sector and private laboratories. There's also a specific role for the NGOs who have linkage with the communities. So right now there are WHO guidelines called technical guidelines for the different rules about hospitals, community infection control, about communication strategy to the community. But I think the very most important one is that how you can put it down into the specific guidelines for different organizations, get them to be piloted and revised at a country basis, and then give to other countries, because we can see this virus might go to be with us for a longer time, and it might come back in the winter time again. So that is something, as a developmental scope of health, we are preparing a proposal for the CRHR to try to translating these different resources and lessons to not only Canada, but also to other low and middle income countries. So that's it.